Hello, students. Don't you just enjoy seeing my little face whenever we start these videos? Well, that's the end of the comic routine. We are in chapter 11, and this chapter combined with uh, essential science content really is where you move from being able to do a massage to providing massage as a therapist, as a health professional. So it's all about assessment and decision making, and everything we've had thus far has prepared you to make this transition. And here at Health Enrichment Center, we started this just after midterm exam. So here we go. Share screen. All right, chapter 11. All the way down here. Look at that. So you've been doing all of your chapter tests. You've been using your Evolve site. You've taken advantage of the YouTube channel and all of the various demonstrations. You've looked at the various videos that accompany each one of these chapters on the Evolve site. You've been practicing. Excellent, 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 excellent. So here we go. What is assessment? And then the aspects of assessment: physical assessment, postural assessment, gait assessment, range of motion, joint range of motion assessment, basic orthopedic tests, palpation, muscle testing, putting it all together. You already are, for the most part, performing the methods that you will use, because you adapt what you've already been doing as far as the uh, general massage, and it is more about paying attention to what you see, paying attention to what you feel, and uh, asking the body, is this normal for you? Is this something that can, and the client too, not just their body, is this something that has a realistic expectation of being able to assume a different level of function? Is this resourceful compensation, and is this something that massage can support rather than change? So here are our chapter of objectives, and you are conducting an interview, you're explaining the various instruments. How would you take this information and explain the assessment process to a client? All right, key terms, your overview, and then assessment procedures are massage therapy. And then there are some more focused and precise assessments that you can include. Some of these overlap with other healthcare professionals. And so it, it is, when we're doing an assessment such as a joint movement assessment, we're looking for need to refer information if we're involved in a consultation with another healthcare provider, uh, places where we need to adapt in order to provide effective massage and safe massage, and places that maybe we need to avoid. So these are the questions that keep coming up when we are asking questions and seeing what kind of responses we get. Not just verbally asking questions, but the way we move the body, or the way we touch the body, the sensations that the person may feel, the sensations we feel. This is all assessment. And it's a mindful process. It's a paying attention process. So always begin each massage with this question: What information do I need to develop a safe, effective massage therapy treatment plan and session for this client? Okay, so here's an example. And you know how important the examples are to take the um, more academic type of writing here and put it into a visual that you can kind of walk through in your brain, an application process that is part of a learning strategy. Okay, really important piece here is that most of the time available for massage assessment, most of the time during the massage is assessment, not intervention. So in a general 60-minute session, assessment, of course, is going to be part of our chatting with the client and finding out what's going on, assessing the tissues, but the actual trying to shift something, the actual intervention process may only be 3 to 5 minutes of that. And you will find that if you just modify slightly the general massage process, you'll be able to affect change that the body is ready to respond to. So you don't have to narrow down and get real focused and all of that most of the time. Sometimes you do, but most of the time it's just these subtle, gentle modifications in the massage. So, for example, slow down, increase the drag, maybe increase the repetitions, or change your direction, pull the tissue up, or move an adjacent joint, or these are things that you can easily do and weave in to the massage. So another mentoring tip here, and then we get into the idea of assessment methodology. So it really is a learned skill, and the paying attention part of assessment needs to be practiced. If you are not confident with your general massage approach, if you are still constantly thinking about, now, how do I put this bolster here? Or where is this drape supposed to go? Or where am I supposed to go next in terms of the pattern of the massage? Your brain is still focusing there, and you're not going to be able to recalibrate that focus to, here's what I notice, here's what I feel, here is an area of asymmetry. This side is a little different than that side. Why? I want to know why that is. So I really want to point this out. It is really important to identify what not to do, and then when to refer and how to consult with other health and medical professionals. Safety first. This isn't limiting the scope of practice of massage to do this. It's not limiting your skill set. It is enhancing and encouraging collaboration. So make sure you read this. So here are your components of assessment. Here's an algorithm. Your assessment is going to be related to your outcome goals. So if the outcome is relaxation and well-being, that's going to require a whole different assessment process than one for the outcome of functional mobility. So this box is really important in putting all of that together. It actually gives you the content, the goals, pain management, and then appropriate assessment and treatment recommendations. Treatment would be your intervention. All right. And then another important concept here is that assessment and application are almost the same thing. It's just that nuancing. And you have to learn it in pieces. But in the real world, with practice, it all comes together. It's hard to discern if you're watching somebody, an experienced massage therapist, it's hard to discern where's assessment and where's intervention, and how's that fit in with the whole outcome goals and the treatment process. Assessment does not change a condition, rather it attempts to understand it. Interventions, well, you can also think about them as a treatment or a method, a specific method. Interventions are intended to change the abnormal findings revealed by the assessment if it's indicated. Remember the importance of resourceful compensation. So that's the next part of this. Slow down, pay attention. Now, as far as what is tested on the MBLEX exam, this information is usually implied and integrated into the more scenario-based questions, the higher level questions, the concept identification questions. You might find those where two concepts are interrelated. A client indicates stiffness in their low back. Which of the following assessments types would you use? And so, that's that kind of thing, that it's not more definition based, but if you don't understand the definitions, if you don't understand the language, then you're not going to understand what the question is asking. So you really do need to understand dysfunction as a solution as well. We've all done it. We've all done where we didn't want to do something, or we didn't want to go someplace, and we said, oh, I'm sorry, I can't do that, I have the flu, or whatever. So sometimes we have to look much bigger than, this person is prone to headache. So we must be having to deal with neck extensors, and there's got to be a trigger point or something in there, and it doesn't improve. So maybe that's a solution there for somebody. Maybe that's the best they can do to manage and cope with their life as it is. So if somebody is going to reveal themselves to us, which is what assessment is, we've got to have some rapport with them. Remember, massage is a people business, it's a service business. So pay attention to the section on rapport, and then we need to be observing from the very beginning, even how we listen to a client when we're talking with them on the phone. So how do we observe? And you pick up nuances when you're observing, even if you aren't necessarily consciously aware of them. So this is where that instinct, that intuition interplays. If you find yourself continuing to go back to something, or you want to touch it again, or you want to look at it again, or you keep thinking you need to know more about something, then that could be your intuition, that collection of knowledge you've got trickling up into your consciousness. There are some stylized gestures people use. For example, if it is radicular or a nerve tract pain, they'll tend to draw a line on it. If the tissue is stiff, if there's densification in the area, they might pull on it or try to stretch it a little bit. So there'll be some examples here, and then proficiency exercises are in play here so that you will integrate and practice these concepts. So here are some common gestures that may be what the client is indicating. So you do need to learn to talk therapeutically with a client. And communication skills take us back to chapter 2. So, and in chapter 2, I suggested that people get additional training in communication skills and effective listening and establishing rapport. So here are some suggestions on how you can establish that communication openness. Now, remember, the communication from your mouth and your gestures and your voice tone and your body language is about a client-centered approach to the client, now, the client may not always do that. And they might even be chatty during the massage and talk about things that are not massage related. You listen through the chatter and see if you can find relevant information. But your job is to sieve it through the therapeutic massage interaction and not to talk about yourself or not to take the chatter away from the massage approach. So here's a sample script that I think would really help if you role played this and practice this on some family members and you won't do it just like this, but it will give you that pattern of conversation and it explains the whole intake process. So it also can be used as a pattern of how you would explain on your media, like a web page or something. Oh, what's the first visit like? So really pay attention to this box. It's a big one. Okay. Now we're going to get into some specific assessment procedures. And when we start doing this, we're now into the objective aspect of assessment. What can we measure? What can we see? That kind of information gathering. So we got to know about biomechanics and kinesiology. And that you got a whole chapter about that in Essential Science. And this is going to talk about the applied force, how applied forces when the tissues are loaded during massage. What is the result of that? And so attention, stress, force, stress, tension loading. If it is going to be causing an injury, this is the injury that occurs. Now, we can use these very same methods as an intervention. But so, for example, if somebody has a tension loading injury, like a torn hamstring, which is really common. In the acute phase of that healing process, I would avoid loading that tissue with any kind of an elongation or a tension loading. However, during the remodeling phase of that healing process, I might gradually load that tissue with the same force that it initially caused the injury. So, there is a continuum here. When we're looking at kinesiology, that's the study of movement in general. These are the general functional processes we need as a baseline for our daily living activities. So we have to have stability, and we have to have balance. It's especially during the aging process, when these become compromised for a variety of reasons, this can lead to falls, which is a really serious situation for people who are older. We need to be able to coordinate our movements, and we need to have some endurance. And this is a full body response. This is nervous system, our inner ear vestibular system, eye reflexes, integrity of our joints, whether they're too lax or too stiff, how the muscles coordinate between functional muscle units. So these are the things that are important, and we can assess these, that are important in terms of the general function of somebody. It's not an individual muscle. It's not an individual joint. It's not an individual tissue. It's all of it working together. So in the medical world, this needs to be objectified. There's usually a documentation instrument. And it's helpful to have this across the board, because a client can externalize this and see that the massage has provided benefit for them. So here are some subjective measurements. There's pain scales, pain drawings, numerical ratings. This is the one that is very helpful, and it is developed by the Veterans Administration. And this is common. You've probably already seen this one, the faces. And then there are actually questionnaires, and the McGill Pain Questionnaire is typically available on you can get access to it for free through an internet search. And then you can you can use these scales to direct your conversation. So pain scales are really good for acute pain. They may not be as accurate for chronic pain, because chronic pain has moved away from the initial value of pain. So pain is protective, but chronic pain has kind of gone rogue, and it's not protective anymore, especially in an acute illness or an acute injury. Pain is a subjective experience, and sometimes what we will use is some sort of a activity, and see if somebody can do it. And people tend to describe whatever feels uncomfortable. They'll say that's pain. And many times it can be stiffness, or kind of they're off balance a little bit, and so there's a hesitancy, and then they would describe that as pain. So we have to sometimes clarify what that means with our discussion. I say, so if you were going to describe this without using the word pain, how would you describe it? And then that can actually direct. They'll say, well, it feels stiff and it's kind of stuck here. And that way you can kind of go, okay, this might be a joint specific problem. This might be some lack of sliding in between soft tissue layers. This might be a compression issue on a nerve, and they're getting a pinching when they go in a certain range. So um, try to get them to describe what they have categorized as pain, not using the word pain. Objective measurements are not black and white, or they're not as factual because they are open to interpretation. So what I might see might not be what Luke sees, might not be what you see. So what I feel, what I measure might not be the same. So we need to also qualify these objective measurements. And there's questioning now of, is symmetry, especially when we do a postural assessment or we're assessing strength on both sides, how important is symmetry? And we're starting to realize that it's not as important, and lots of times it is not problematic if there's a lack of symmetry. So, but it doesn't mean we don't look for it. We don't look to see, what is the continuity between left and right side, or front and back, or a joint movement, from left to right. Functional capacity, I think, is a more insightful assessment. What can you do or not do, or what are you struggling with to do right now, and you want to improve that function. So this has to do with being able to do something. So I can work with say I'm working with somebody who plays golf, and they want to, uh, they feel like their swing is compromised. I mean, I can go through and I can do a very precise joint movement assessment for range of motion in each of the joints, and I can do palpation, and I can do all this, or I can ask them, show me, swing a club, let me watch. And then you describe what you're feeling in through there. So that's your pre-assessment. Then you give them the massage session, and then you ask them to swing the club again at your post-assessment, and then have them report in conjunction with what you notice, what you observe, and see if there's been a change. And then 24 hours and 48 hours later, what happens immediately after the massage is not necessarily reflective of what is going to be the longer term benefit. So here we've got some uh, ideas about how we would try to objectify a feeling, a palpation of tenderness here. And again, tenderness typically falls into that interpretation of pain. So, but we can try, right? And you want to watch for these pain behaviors, because sometimes we're just pressing too hard, or we're pressing too hard in the wrong, over a bony area or something, over a nerve. So when we are assessing, we want to stay here in this tenderness, you know, without a physical or verbal response. And then you want the person to externalize that. You want them to tell you, yeah, that's where it's at. Sometimes they won't process it until it's into a grade 2, and then they will notice it. But we want to avoid withdrawal and tenderness, where they're really, have an avoidance behavior to that. We don't want to work in that arena with people. Same with some muscle testing, which we're going to describe here. And we're looking for normal and good. But when it starts to get into this poor, trace, or zero range, that may indicate referral, or there's a logical reason for that. There has been a previous injury. This is the way it's healed. This is the best it's going to get. So this box is really essential. It takes all of the various forms and it tries to pull it into a sequence from beginning to end. So slow down and pay attention to this box. I love this box. This is a very important box. Okay. This is a good box. All right, here are our individual assessments with standing and some guidance on that. And then an idea around what might be causing a postural distortion. I have that funky knee and it has compensated and shortened into some flexion based on shortening of the gastrocnemius and the hamstring. That's a good thing because then there is some stability there, but you're going to see some compensation into the opposite hip. You will notice when I walk, I'm flat-footed because if I do a normal heel toe gait, then it's going to put the knee on extension, and the knee doesn't like to be fully extended. So here are some visuals to help you look at what is typically seen as normal, and then the mechanical balance and the videos that accompany this chapter on the YouTube, or we have some on the YouTube, but particularly on the Evolve site. And at the end of this discussion, I'll show you those do an excellent job reinforcing all this material. And then here you go with some procedural guidance. And then intervention guidelines. What do you do if you see something that is an indication for and able to adapt? And we have the same thing with gait. You may encounter, maybe, you'll certainly encounter the word gait, posture, that sort of thing. I don't think on the NBLEX exam you're going to have specific terminology related to these specific gait dysfunctions, but you might encounter it as you're interfacing with another health professional. And here's your assessment. And then an example or an explanation of this little figure-8 movement that happens at the sacroiliac joint. And then muscle group interactions. Again, nothing ever happens in isolation. So here's your intervention guidelines with this. And then here's a proficiency exercise. Here's an assessment and an intervention process. Again, demonstrated very well on the videos that accompany this on the Evolve site. But there are some graphics here. And then kind of pulling all this together into some key points. So we've got range of motion assessment as well. And we are assessing range of motion by doing joint movement. So here are some examples of typical range of motion. And then at the end of the range, what do we feel as we approach the actual joint capsule itself? And we almost always want a soft tissue end feel. We don't want a hard bony end feel, or we don't want to feel like it doesn't have an end feel. That would happen if the capsule or the ligaments surrounding the joint capsule have been compromised. So here are the here are the abnormal end feels here. These end feels here would be considered normal. And then these are your abnormal. And so moving how you've been taught to move all the joints of the body and pay attention during positioning, because that also requires the person to move their joints, become important. And I've demonstrated previously the idea of loose pack and close pack positions. In a closed pack position, the ends of the range, I'd used my arm before on the elbow. So this is maximal flexion. This is maximal extension. Both of these would be a closed packed position. And right in between the two is where your loose packed or least packed position is. And then some intervention guidelines here. Maybe not. Will you see the terminology used for basic orthopedic tests? There is concern about whether or not these are within the scope of practice of massage. I think the ones that are presented here in the textbook give you a good idea for referral. So these here, discomfort or asymmetry, a lot of asymmetry, would be an indication for a referral. And then here is a sequence here for joint assessment. So again, this is a slow down, pay attention. Then we get into palpation. And this is what we do every time we are doing a touch-based massage, is we are palpating. So this is divided into us from surface, above the surface actually, to very deep. So you're going to want to practice these. And then again, there is a video that supports this. Pay attention to the color here, and also pay attention to that different skin tones can have a different representation of these changes in the skin. Also pay attention to hair and nails, and then the superficial connective tissues. The skin superficial interface should slide on the deep fascia underneath, but it should have a integrity. It shouldn't slide off. It should have an excursion in a local area, about like what I'm doing here and with my fingers. And then we've got our lymph nodes and vessels and muscle tissue. In your essential science book, it gives you a lot of guidelines and examples of how to palpate muscle tissue. You want to make sure layers slide back and forth. This is where we might introduce some muscle testing as well for strength and the integrity of communication between the nervous system intervention guidelines, and see how it's going through. We're getting into the tendons. So the location of tendons is not in the, it's more at the ends of joints, not in the middle tissue. Here are the fascial planes and sheaths. This is how the body compartmentalizes itself. And these compartments should have a layer of movement amongst the compartments. And your intervention guidelines. So this picture here, for example, is what I'm doing to try to bring some separation between two compartments. Ligaments are going to be around the joints as well as the joints. And when we are in your Essential Science book, in the joint chapter, there for each joint, there's a specific palpation sequence. So this is an example of where those two books complement each other. Pay attention to this box, as always. And then this right here can give you an idea if it's more soft tissue related or if it is more joint capsule and inside the capsule related. So pain on general traction usually indicates, or discomfort indicates a soft tissue issue. Pain with gentle compression or discomfort, you're pushing the ends together, the joint ends together, the bones together, can indicate a ligament or a joint problem. And then if active range of motion, active joint movement produces pain or discomfort, and passive range of motion, moving the joint, does not, the cause usually is a muscle or tendon problem. But if both passive and active range of motion assessments produce pain, then it is more likely that there's a ligament and joint involvement. And so then here we also talk about anatomical barriers. That's where the structure stops the movement. And then we hardly ever, our body just doesn't take us very often to the anatomical barriers. We work within a physiological barrier. And then if that has shifted, it can be considered a pathological barrier. And you may find this terminology on the MBLEX. And intervention guidelines. Well done. And here's your bones, and we can palpate bones. There are areas on the body where the bones are very surface and under just a very thin layer of tissue. The sternum here is an example. Ribs, bones here around the skull, in the fingers and the toes. So, and then we get into the abdominal area, and massage of the entire trunk, back, sides, and front, which would include the abdominal area, is important. That whole structure around acts like a girdle that provides a tremendous amount of stability. So that's the abdominal wall that needs to be included. Now, we also, while we're doing that, may be able to palpate some of the actual organs, particularly the liver. And we want to be careful there. We don't want to push down into the viscera. But if we notice that there's hardening or pain, or you can feel the pulses from the ascending and descending aorta and that sort of thing, then that needs to be looked at. That could be a referral. So here we're talking about that important intervention guidelines around that whole thorax that I talked about. And the raphets are the seams and how the tissues come together and then disperse again, but they're really all one thing working together. And then we can get into the idea of rhythms. The one we pay most attention to is the respiratory rhythm, and whether we're discerning for ease of breathing or is there some just distorted breathing function. We can palpate the pulses. We can do a nail bed and see what the vascular or capillary refill is. And then we can palpate kind of a little bit of an undulation of lymphatic circulation. It's very subtle, it's very slight. And so there are these fluid rhythms that we can get an idea of, and they should feel easy. It's kind of a little abstract here, but they should feel functional and even on both, especially with the pulses, should feel even on both sides. So here it goes into the breathing a little bit more, which is an area that I encourage all massage therapists to pay particular attention to, because it is the area that we can have the most external influence on, with making sure that the breathing structures are working as well as they can, as well as supporting a coordination between the sympathetic and parasympathetic aspects of the autonomic nervous system and vagus nerve. And there's a lot of influence here on behavioral and perception of safety or danger. So again, here are proficiency exercises to help you develop this palpatory skill. Please pay attention to these. Here's a picture of the main pulses, and you would feel on both sides, and they should be fairly even on both sides. Then we get into some muscle testing here. And again, the videos that accompany this chapter give you excellent guidelines on how to do this. And here's the measurement category, and then how to do it. And we're looking for general information. We're not doing this specifically to identify, a specific neurological interaction. But if we notice a difference, if we notice differences from one side to the other, then we need to seek to understand it. Is there a logical reason for this? And if there isn't, or if our gut is telling us that there's something else going on, then that would indicate referral and consultation. So part of this then becomes the coordination between agonist and antagonist interaction, and how these muscle groups do interact. And one of the ways is these functional muscle groups called muscle activation sequences or firing patterns. Let's have, again, multiple names for the same thing. The ones that we show you to do are the ones that are involved in large movement. Every joint has this, but when we look at shoulder adduction, for example, or abduction, or hip extension, hip flexion, if if these are functioning pretty good, then you get a fairly good downline function. So here is the proficiency exercise for that. And again, really, really good support on the videos as well as the YouTube channel for this. And we talk about all of this in the classroom as well. So this should be review. Yeah, and it gives you some symptomology here. Let's look at the firing for hip abduction. These two pictures right here. This is what should happen. You palpate and ask them to produce the movement, which is to just bring the leg up a little bit. And you should feel gluteus medius and tensor fasciae lata kind of engaging at the same time. And then quadratus lumborum comes in after these two have brought the leg up. And then to tip the pelvis, that's what the quadratus lumborum does. To increase that abduction, the pelvis tips. So here's how we assess. And then here's what happens if it's not optimal. And then here's what's important. This is what the client is going to tell you. So if they come in and say, I've got some sense, some discomfort in my knee, and I also have a spot here in my back, this would kick you into thinking about this. These are not hard to integrate into a general massage. I do them for every massage. It's really easy to do. And the intervention's pretty easy. You just inhibit the muscles that are firing too quick, and then you have them try to move it through the action. Then more information here again on postural and stabilizer functions and phasic mover interactions. Now we're getting pretty advanced here now. But you may hear this terminology, or you may see this terminology on the MBLEX. So postural muscles have to hold a static contraction for a long time because they're keeping us upright. Now, when we lay down, we take ourselves out of gravity. We give some relief to these. Movers, they're the ones that are, allowing us to reach out or to run or to turn our head. Now muscles can do multiple jobs. Muscle patterns can do multiple things. But if there's something within these postural muscles that the stability isn't there, then these movers might try to take over that job, and they don't do very well. And this is where you might start to see some alteration in posture, alteration in gait, alteration in the firing patterns, and the development of discomfort. So here's more information on that. And then this box right here, this is a wonderful box. And it talks about the arrangement of muscle groups. And so, for example, let's look at this blue. If somebody had some sort of assessment, we find a change in tissue and assessment right here. Let's say there's some pain behind the knee, and the person's gait is a little distorted right here. I would want to make sure that I included this whole group and not work just in this area. I see this a lot too. These stabilizers here, not rectus abdominis so much, but this whole girdle I talked about. And there are some anatomists that think that the adductors here in the leg are an extension, or they're part of the whole girdle trunk core system here. And if a person is not able to hold their legs stable when they do a squat, for example, it may be problems with this girdle area up here and not the adductors per se. Very helpful picture. I'm very thankful for the use of this information by Joseph Schwartz. And I really think that you would benefit from actually getting some of his material. So here's the kinetic chain idea, the relationship between body areas, places where we move specifically on the transverse plane. So this is where we twist, and we get a front-back relationship. So if I've got an issue going on in my shoulder, I'm probably going to have something going on above, in the front and on the opposite side, above and below it. So it's really good to kind of try to get these patterns in your head. So here are some activities to help you internalize that. And here's another representation of that, of the tippy pole idea. So typically, in general, we would apply our massage methods in the caves to bring about a reduction in tone, an increase in pliability, and reduction of the shortening. And then the nervous system would stop inhibiting the muscle structures on the opposite side. And then some stimulation massage, as well as some activation and exercise could start to bring some balance to that. Now that's really simplified. This is all compensation as well. So you can't just work in one cave and expect there to be a sustaining result. And it takes time. It takes time for these patterns to improve. So here's your intervention guidelines, and certainly focus on professionalism, always, always, always. And then putting it all together into a functional biomechanical assessment. So we've got the 4-element movement system model here to take a look at. So motion, ability of a joint or tissue to be moved passively. Force, ability of the contractile units and non-contractile structures to produce movement and provide dynamic stability around the joints during static and dynamic tasks. Dynamic means movement. Motor control, ability to plan, execute, and adapt a goal-directed movement. So taking a step, standing on one foot, bending over. Is there an ease? Is there movement grace involved in that? Or do you see strain and compensation? And then energy and or stamina here, the ability to perform sustained or repeated movements, and how it is integrated into the cardiovascular, pulmonary, and neuromuscular systems. So this is a very good way to conceptualize function and dysfunction. So when we are observing for this and assessing for this, what we're looking for is control, amount, speed, symmetry, and symptoms. And then it gives you the bullet points here. So control means it's smooth and coordinated and the timing is right. The amount is is the how big is the muscle contraction, for example? How coordinated? Can a person produce just a little bit of a movement, or does it have to be full-blown movement? Symmetry speaks to itself. And then symptoms: stiffness, pain, instability, or fatigue. Sometimes the person will describe it as feeling heavy, and that could be how they're describing fatigue. So potential issues and how you might provide, alter and adapt massage here would be to look at local joint function. Pay particular attention to laxity or hypermobility. Tissues around that will feel stiff. The joint may actually assess hypomobile because the tissues around it are shortening to try to provide some external stability. Looking at gait dysfunction, also the firing patterns that we just went through, and the postural imbalances. So here then we're putting all the pieces together, and you can practice these sequences. And then we're looking for these distortion categories. So we've got first degree, second degree, and third degree, and how much challenge there is for the person to function is going to indicate whether we work autonomously, where we work, we need to think about a integrated care plan for somebody, and when it is really important down here on third degree, when it's really important that the person is assessed by a qualified medical professional to really look and see what's going on here. Massage has a place in all of us, but it is how we team up with others and when we can act autonomously. So we can work with first degree distortion. So this falls into stage 1, all right, functional tension. And then as a result, the person can do what they want, but it takes more energy. We can work with that. Stage 2, functional stress, then we need to be concerned. This might be the point where we would get into referral. So as a result, the person can still do most things, but not as easily. And they'll start to avoid activities, and they'll use more energy to achieve the same function. Now, unfortunately, many of our clients, especially if they're experiencing soft tissue type discomfort, fatigue, that sort of thing, they'll come see us at second degree distortion and functional stress. And so, it depends on how significant the changes are. We can do massage and see if the person moves into a more functional space, or we might start to suggest interface with other professionals that can help. So when we get into this third stage, there's significant things going on, and we don't want to work here totally by ourselves. We certainly are going to get connective tissue changes here and compensation. So here gives you, the discussion on what I had just talked about. Stage 1, functional tension, what we would look for with our assessments. This is a really good graphic giving you some examples of visual assessment and the squat assessment here, standing on one foot, and then some intervention guidelines. This is all clinical reasoning and problem solving, all of it. It falls right into the whole idea of even the scientific method and how we gather information and how we have to analyze it. And then we provide intervention and how much and when, and then we have to reevaluate. So this table here gives you some guidance on stages of healing, and you will encounter this. So pay attention to this on the MBLEX exam. Acute, subacute, chronic. It gives you the clinical signs, the massage intervention. And then this table also is important. You will encounter questions that encompass this information. So in the acute phase, what do you do? In the subacute phase, what do you do? In the remodeling phase, what do you do? So this table is, I think, really helpful. So it takes the various assessment procedures and identifies what you would take a look at based on the evidence-informed outcome goals. So with relaxation, outcome, and well-being, what you will see is that we're primarily looking for systemic and local contraindications. So the interview and observation and palpation are our main identifiers. And then also rhythmic joint movement can also give us some information. When we move down here to stress management, now we have interview, observation, possibly these others, but certainly functional physical capacity, joint movement, and palpation. And as we move into more complex situations, pain is complex, then our assessment becomes more complex. And then we need to also start to be confident in how we will create quantifiable, measurable, and qualifiable outcomes. This is what the person can do. They're functional. So here's a reminder on the critical thinking guidelines that have been presented throughout the text, and then how this all comes together to create a care and treatment plan. Now, chapter 16 gives you 20 case stories that incorporate all of this information. And so now's a good time, if you haven't looked at chapter 16, to go look at that and see how all of this information is integrated. So here's your foot in the door, an additional box, the summary, ta-da, and then the learn more on the web on some of this information. The links are on the Evolve site. And, always double check the references. That's a good activity. And then the multiple choice questions for discussion and review. All right, here we go. Ta-da. So I'm going to stop the share, and I'm going to remind you to look at the videos on your Evolve site multiple times. Have your book out while you're doing that. And practice. You can slow those videos way down, and you can have them playing while you're practicing. Even if you're just practicing on yourself, you can do some of this. You can palpate and you can joint move and all of that. It is repetition that gets this below the nose, and so that it feels seamless as part of the massage. And do take advantage of the YouTube channel. There are just lots and lots of demonstrations and reinforcement on this. This is the content that's going to move you towards the idea of actually a therapeutic intervention, to take those outcome goals and translate that information so that your client really does benefit.